Okay. Good afternoon, everyone. I am Irma Richardson, one of the co-chairs for the Research Education Advocacy Committee of the Women's Fund. And I would like to welcome each of you to part 3 of our 4-part series, Ideas to Action. And part 3 is about access to affordable childcare. Today, we will hear from local experts in early childhood education and access to childcare. We will learn more about how to ensure that women can enter and remain in the workforce, and as a result, increase their earnings and expand employment opportunities through reliable and affordable childcare. We will also learn about the work being done locally to increase access to quality, affordable childcare, and discover ways in which we all can help move forward community-led solutions. And first, I would like to share with you a quote from President Barack Obama related to childcare. It's not a nice to have, it's a must have. It's time we stop treating childcare as a side issue or a women's issue and treat it like the national economic priority that it is for all of us, end quote. So today, as you go to your breakout sessions and listen to these local experts, remember you can have candid conversations with them to find out information on what is being done here in Forsyth County. So thank you for spending a little bit of your time with us today. Shamika?
Thank you so much, Ms. Irma, for that great welcome and introduction. I am Shamika Stark, Director of Strategic Initiatives with the Winston-Salem Foundation. And before we got started today, we were just having a little chat about how timely this event is, because I have had a little childcare issue today. And so if my little happens to wake from her nap during our presentation today, I know that she is in welcome Zoom screens this afternoon. And so just thank you all in advance for your patience and grace through this process. But I will just get started and give a brief overview and introduction of the Women's Fund just to provide some context for today. And so I'm going to quickly share my screen and hope that all goes well with our IT. And I think I got a nod that we are okay. And so again, good afternoon and welcome. And really wanted to just use this opportunity to first introduce myself as Director of Strategic Initiatives with the Foundation. And so for those who may not be familiar with the Foundation, the strategic initiatives include, in addition to the Women's Fund, also our Black Philanthropy Initiative and our Youth Grantmakers in Action. And so these initiatives of the Foundation really represent an opportunity and a targeted effort to really engage populations that are typically and often marginalized in this work, to be entrusted with the power to really lead and work and facilitate philanthropy that help to address a lot of the critical issues that are impacting our community. And so all three of our initiatives really encourage any and everyone who are interested in the respective missions to really give of their time and their talents. They give of their resources, and then our volunteers, who are often our donors, also connect those resources to action in different ways in our community. So just want to thank you again for joining us today. More related to the Women's Fund. And so our mission of the fund is to engage our community to build economic security of women and girls here locally in Forsyth County. And so the Women's Fund includes hundreds of members each year, and we use those membership dollars that are raised for our annual grants process, which typically invests an average of over about $100,000 annually over the past about 15 years. And to date, we have, I think towards the end of last year, invested over $2 million to support the economic security of women and girls here locally. For the membership models, we currently offer 5 different levels, which really only differ by donation amount. And so regardless of which level that you choose to engage and give of your time, talents, or treasure, each member really has an equal opportunity to engage and participate in our annual grant making process, and has access to other member opportunities that we may offer throughout the year. And the fund was also excited to introduce our complimentary membership option in 2021, which really allowed us to expand philanthropy and kind of shift the narrative so that we can start to view every and anyone as a philanthropist, which means everyone can really make an impact on issues that matter most to them. And so we're just excited that you chose to join us and give of your time and talents today. And just briefly for context, so in November of 2020, the Women's Fund released their most recent research report, which was launched in the form of a microsite. And so to visit, you can visit wfgenderlens.org to explore the report and research in more detail. But this was the third report from the Women's Fund since it started releasing data in 2010. And the Women's Fund Research Education and Advocacy Committee really worked alongside our data partner, Forsyth Futures, to develop a report that decided to develop the report. And instead of providing recommendations, they really wanted to engage our community to expand and invite others and many voices to participate in that process. And so with that in mind, the committee created a series of community conversations, which was launched in February of 2021. And the goal was to for our community to provide input on what actions they thought should be considered to improve economic security of women and girls. And so from those conversations, there were 4 themes that we identified. The first theme was around the need to address root causes and having significant change at the policy and systems level to really have meaningful impact related to economic security of women and girls. And the second was to really ensure that women and girls of color and also women and girls with current or lived experience to the relevant issues were involved in a part of advocacy efforts or efforts to address those issue areas. The third theme we saw come was around, communities' resistance to change and the lack of clarity around our direction and where to begin on such complex issues can also become a barrier to change as well. And finally, along the same lines, we clearly heard also from our membership and the larger community that there was a desire to learn more about local advocacy efforts around these issue areas and how might individuals be able to kind of join local organized efforts to build on our collective power and impact as a community. And so based on these themes, we had invited community conversations, and there were 4 really action areas that rose from those community conversations. We've already held the Ideas to Action series to be able to address our first 2 action areas. The first was on affordable housing, and then we offered our second on equitable education in June of last year. We also realized that we needed more time to be able to engage and offer the community opportunities to kind of dive deeper into these conversations. And so really wanted to provide that opportunity for you all and are excited to hear from our presenters today to share more about improved access to affordable childcare. Our 4th and final Ideas to Action series will be in April, and we will be sharing that date with you all soon. So hope that you stay connected with us. And so as we get started, today's program will start off with a presentation from our friends from Family Services Forsyth and also from the Childcare Resource Center, Leslie Mullenix and Katura Jackson. Thank you so much again for sharing your time and talents with us today. After their presentation, we'll have an opportunity to continue the conversation in a Q&A format and allow you the opportunity to choose one of 2 breakout rooms with our presenters. And so one will focus on early childcare and the other on pre-K. And then we will come back briefly just to share some closing remarks and send you off for your day. And so without further ado, I would like to pass it over to our presenters today to get us started.
So, hey, I'm Couture Jackson, and I am with Childcare Resource Center here in Winston-Salem, and I have been working on early education and care issues for the past 30 years, even though I may not look that old, I am that old. And I pulled together some information for you all to provide an overview of what our system looks like in Forsyth and where our challenges are. I think we all know that COVID-19 has put a spotlight on childcare and the fact that our childcare system is broken. Many families are looking for childcare. Our childcare teachers aren't paid enough. Providers are having a hard time trying to make ends meet, even with the federal government providing some subsidies. And so just trying to understand how we can make a difference. Also, even before COVID, 53% of the states reported that they had a decline in the number of child care centers, and 79% reported that they had a decline in the number of family child care providers. And so this is a reality for our community as well. And then for Forsyth, we've seen over the last 10 years, we've gone from having 300 licensed centers and family child care homes to about 171. And that number is even a little bit lower as I went in and did a little bit more research over the weekend. And so as you can see through this slide, I pulled some statistics from Childcare Services Association out of Chapel Hill. They do a workforce study, and in 2021, you could see that they showed that we had 98 centers serving 4,572 children, and then 73 programs, family child care programs, serving 304 children under the age of 5. And just to put that in context, that's about 5,000 children. We have over 27,000 children in our community who are under age 5. And so trying to figure out where those children and families are has also been some of the work that we've been doing, and how to support them in the care situations that they are in, because surely they are not all being served in licensed childcare. Next slide, please. This is just an overview of the center-based and home-based programs. The centers are in blue, the family childcare homes are in the rust color. And as you can see, that most of the children in our community who are using licensed childcare are enrolled in a 4- and 5-star program, which is supposed to be the highest quality type of care that can be provided in our state. And then most of them in operation are also for-profit entities. And so with, the total number being around 170 programs in our community, we just decided to take a deeper dive to say, okay, so how many of these programs are actually serving children under the age of 5 or birth to 3? And so 50 of the licensed programs, the total 98, are actually serving children birth to 3 years of age, which presents a challenge for families who are trying to work. And then the remaining are serving, NC pre-K, preschools, or after school programs. So even though it looks like we may have quite a few childcare programs, we really don't have as many as we need to be able to serve all of the children in our community. Next slide. This is just an overview of compensation. Parents pay a lot for childcare, but the childcare teachers don't make a whole lot. And so just looking at the averages of what people are earning with the ARPA dollars, American Recovery or American Rescue Plan dollars, childcare programs have been able to provide an increase in compensation and to subsidize, subsidize salaries. Hold on a minute, I'm gonna make my computer phone, I'm gonna cut it off. Apologies. They've been able to increase compensations, to subsidize salaries, to pay, up to $15 an hour. But the concern is that when that runs out, those funds run out in December 2023 this year. What will happen to those childcare teachers? Will they leave the field? What will happen to those programs? Will they have fewer spaces? And that's an even bigger challenge for our community. Next slide. So we are looking at this slide, shows staff in childcare settings are educated. A lot of times people may think that they're babysitters, but 55% of the teaching staff in centers and 51% of the staff in family childcare homes have at least an associate's degree. And most have worked in the field for at least 12 years. And so you can see that we do have an educated workforce, which is good in terms of outcomes for children. But then again, as I mentioned earlier, not all children are enrolled in licensed childcare. Next slide. Early care and education is a female-dominated industry, as you can see, and the average age of the staff is 51 years old. And so we need to figure out how we get more young people into the field, and then the majority of the staff are female women of color working in childcare programs. Next slide. Okay, so what does this mean for families and with young children? Next slide. So as you can see, 69.2% of children live in household where the only or the both parents work outside the home, and 50% live in households earning a median income level for Forsyth County. And so there are probably many more children who are eligible for childcare subsidies than there are families receiving childcare subsidies. You have about 8,000, 9,000 children under the age of 6 living in household where the total income is below the poverty level. Next slide, please. And then when you look at the total cost of childcare, I know some of you are living this with it being about $10,000, and that total cost on the screen is an average. It can range from $10,000 to about that $7,000 for family childcare homes. And so when you think about families earning even $15,000 an hour, that's only $35,000 a year. And the median income for our area is about $50,000, maybe a little bit more or less since the increases. And so it takes a high percentage of the household income for families to be able to afford childcare if they aren't getting some type of subsidy. Next slide, please. So I talked about how our system was broken, how childcare is not really affordable or accessible for most families in our community without some type of government subsidy. Currently, 6% of the children eligible for childcare subsidies receive them, and that's simply because we don't have enough money in that subsidy pot. And then, it's really difficult for families to be able to afford childcare. I have a son who makes a pretty decent wage, and he still claims that he has a hard time being able to afford childcare. And so I do understand. I remember I had 3 children when I was younger, and when they finally reached school age, I felt like I got a raise in my salary. Next slide. So how do we transform childcare? How do we make it better? The things that are happening across our state, there are lots of investments in childcare. There's lots of conversation. Businesses are more concerned. Parents are more concerned. We know that childcare helps children not only grow and develop, but it also helps parents work. And so just trying to figure out what we can do as a community, as a country, to try to reduce the barriers. many of the programs, childcare programs, are, considered to be small businesses. They employ about 1,000 people in our community. Many are owned by women of color who've had barriers to accessing business credit and other small business supports. And so again, recruiting the younger people to come into the field, which is why a lot of childcare programs in our community may have spaces available, but they don't have staff to work in those classrooms. And so that has also increased the, crisis situation that we are in. We have staff, parent specialists who have worked with families to help them find childcare. And a lot of times they're calling 13, 14 childcare programs just to find one space. And so it really is a challenge for families, even more so than it was prior to the pandemic, to find a space that meets their needs. We are just trying to, figure out how we do it better in our community and how we help support families and determine what supports will work for families in our community. Next slide. So I think I already talked about that a little bit. Next slide. So opportunities for advocacy. We have statewide organizations that are really focused on how we increase the awareness of what families need, how we increase the awareness of what childcare programs need, childcare teachers needs. And so I kind of highlighted a couple of the activities. One, there's a Childcare for NC, United for Change event in Raleigh on April 20th. This will be a day for both parents and childcare providers to connect with their state legislators and to support increased investments. I've heard that there's a Momnibus bill in going around Raleigh that is focused on childcare supports, which include lots of different things for families, paid leave, health care is included in that, as well as childcare. And so trying to figure out how we support those things, tell legislators what we need is really important. The way that that's going to happen is for both parents and providers to talk about investments. And there's even been some discussion about what we can do on the local level for families and childcare providers who can't quite make it to Raleigh that day. So hopefully we'll be able to put some information out about what steps you can take at the local level. And then there's another one, Think Babies NC, which is a national project of 0 to 3. And we have a chapter in North Carolina. And Think Babies is hosting a national day in Raleigh called Strolling Thunder in June, and looking for families to attend. And so there's some scholarships available to help get families with children under age 3 in Raleigh to spend the day, in Washington, to spend the day advocating for childcare issues. And then finally, I think what would help locally is joining the boards and committees of organizations that are working on the early education issue. I know as an organization, we're always looking for ways to bring parent voices to the table. And so, we're really going to have to change the public will. I always say it's interesting how when a child turns 5, then it is the good of the public for them to go to school and get an education. But then we also know that education begins at birth. And so how do we ensure that children have the early opportunities they need as they come out of the womb? And so that's it for me. Thank you so much. And I'll turn it over to Leslie.
Thanks, Keturah. Keturah and I have been working together for about the last 7 years, 5 to 7 years. And we, before we got started on this today, we were actually talking as some of the presenters were coming online about, well, what really is the difference and between talking about early childhood education and care and talking about pre-K. And we said that there really is, it's a both and. You can't talk about one without the other. So you've heard from Contura. She shared information related to the lack of early childcare options that are accessible here in our county. And I'm going to provide some in-depth information related specifically to the options for 4-year-olds. And that's otherwise known as pre-K, since it's the year prior to entering kindergarten. So I am currently working with Pre-K Priority, and I'm going to give you a little bit more information about them as we go, but I'm going to start with this next slide to just say, well, why focus on pre-K? So if we could go, yeah, what are the benefits? So we focus on this. I mean, we know that the birth to 5 continuum, all of those years are equally important. But the reason that we're focusing on pre-K right now in this kind of time is because we already have a really good foundation that is established for this age group, number one. Additionally, there are a multitude of proven benefits that are linked to high quality pre-K in particular. One of the most immediate is that it provides that really important aspect of social emotional skills that children learn, hopefully before going into kindergarten. One of those is, some of those things are as simple as waiting in line, taking turns, but it's not just that. I mean, there are lots of other things they're learning in pre-K, but what we do know is those sorts of skills are taken for granted, but they're really building blocks towards a positive kindergarten experience, and it helps the child throughout their educational career. We also know from a large body of research, especially some of the longitudinal studies, that children that have high quality pre-K fare better on a number of school-related aspects that begin in kindergarten and continue through their high school graduation. Most of those, or the most talked about, is that 3rd grade reading and math scores and the proficiency around that. And those have been proven, study after study, that children who have a high quality pre-K experience do better in 3rd grade and 8th grade proficiency in not only reading, but math and science. And we actually had Dr. Kenneth Dodge from Duke come share with us a couple of years ago the study that they did of 1 million children in the NC pre-K program, and how they had followed those children through 8th grade, and there was no fade out after 8th grade. They were still seeing the benefits. The other thing we know is after high school graduation, there are benefits throughout the life course related to jobs, income, home ownership, better health outcomes, and less interaction with the criminal justice system. As for the business-minded folks, we always like to remind people that there are respected economists out there who have shown that the return on investment for early childhood education and care is very sound. For every $1 spent, we know that there's about $7.30 realized in the returns in the long term. Now, that does take a while. It's not immediate, so it's the longer outcomes. But everybody can agree that it makes sense for $1 investment. You're getting a lot of bang for your buck, and the children are getting a lot of benefits. So we move on to the next slide. Since we've got limited time, I'm going to try to bucket what we're talking about for pre-K. The first section is going to be about, well, what's pre-K priority? How's it related to what we call universal pre-K? Second bucket is, what is Forsyth County's pre-K landscape? So what does it look like compared to other counties? And then third, what has pre-K priority done to date? What has it accomplished, and what are its next steps? So we'll go to the next slide. And the pre-K priority is a coalition. It's not a nonprofit. And it's a coalition of supporters that have been made up from early education educators and professionals to start with, but now it's grown to a large number of folks that are advocating for pre-K programs of the highest quality available to all families that want to enroll their child in accessible, affordable options. Next slide. And right here you see I like to say it's a smattering. It's great. It's a good group that you see here on the screen, but it only starts to represent the folks that have been involved with this since 2014. We're upwards of 80 plus representatives from different groups, organizations, community, family members at this point have been a part of supporting this. What started with 12 has now grown, and we continue to add people who are supporting us. Next slide, please. So what's the goal? Like I mentioned before, it's affordable, high quality pre-K and access for all families. We want to really make sure that we're telling people as we go about this, that we want to maintain a choice of options in the community that are already established. We're not trying to take away anything. We're trying to add to and improve. So that includes right now pre-K options that are at the school system, the pre-K options with Head Start and the NC pre-K program. And then also all the programs that are similar to what we were talking about in Katora's area for early childhood, those independent and franchise providers that are in our community. So we want to build on this system that we have. We want to ensure high quality programs, no matter what the location or which one the families choose. And we want to make sure those equitable options are opportunities, not only for the families, but they're equitable for teachers. So now, no matter where they go to be a 4-year-old teacher, that they get the same types of benefits and pay. We want to grow current programs and then establish new ones. Those are all some of the forward-thinking things that we want to do as a pre-K priority. Next slide, please. So we'll talk about demographics. What does Forsyth County's landscape look like right now when you talk about 4-year-olds? You got a little bit of information, a snapshot of what our early, like 0 to 3 looks like. And our 4-year-olds here, you can see that the graph illustrates is trying to show how 4-year-olds compare to the general population in Forsyth County. We have race and ethnicity along the side, and then along the bottom are the numbers. And what you can tell here, if you can see, we've got children are the orange bars, and then the general population is the gray bars. And what we're seeing happening is an inverse relationship with the demographics of our 4-year-old population for children of color compared to the number of residents of color. So while the number of white children that are 4-year-olds are smaller than the number of white residents. So this trend shows that our demographics are much more likely to change as we continue to grow. Among 4-year-olds, it's probably going to be more evenly split, and demographically across ethnicity and race. And so we're really going to have to pay attention in a very intentional way of how to engage families, make them feel a part of their child's educational opportunities, and then really also pay attention to culturally appropriate ways of honoring difference in our curricula and our programming. So next slide, please. The next one is this fancy pie chart, and it attempts to show where our current 4-year-olds are currently spending their day. What I'm going to do just briefly is break down each of those colored quadrants. The first one is 38% of our children being in publicly funded programs. And basically what we say publicly funded programs are those that are receiving money. Families are receiving money through the government or some kind of private entity to be able to attend the school or the program that they're in. That would include the Winston-Salem schools, like we mentioned before, Head Start, NC Pre-K, and then also DSS gives out a private pay voucher for families that are able to, or excuse me, they give out a voucher for families to attend a high quality pre-K program. So that's about 38% of current 4-year-olds are in those programs. And generally those are pretty good in terms of the quality because they are publicly funded, they're required to meet certain standards. We have about 22% of our children who are currently in licensed private pay programs. And that basically means that those children and families are paying monthly or weekly tuition to attend a 6.5-hour day program. So to be licensed in the state of North Carolina, you have to provide at least 6.5 hours of care. Then you have the orange quadrant over there, 40%, and that represents children who are not enrolled in some formal licensed care. And when we say formal, like I said again, it is 6.5 hours of formal care is considered licensed. So I have to point that out because we do know in that 40% that about 20 of the, or 20% or half of those children are actually going to a half-day program. However, half-day programs aren't considered licensed in the same way, and so they don't have the same standards. So we've got about 20% of those kids that are in a half-day program, and then the other 20% are basically with family, friend, or neighbors being cared for. So those are some of the options that we have right now in Forsyth County. And what we're saying is we don't want people to feel like they have to put their child into a formal licensed care setting, but we feel they should have the opportunity if they so desire. Okay, next slide. This is, I'm going to briefly touch on this. This is showing some of the inequities that we were kind of referring to before in terms of the public dollars and where things are going. When we talk about NC pre-K program that is administered by Smart Start, Forsyth County, right now, in comparison to a lot of other counties our size, we are not getting enough funding for all the eligible children to be served. We are only being able to serve about 26 to 27% of those children. Whereas for Guilford County, you can see they're serving upwards of 67%. Our advocates and the folks at Smart Start are working with the state to try to make that more equitable. But right now we know that the state funds are not growing in terms of how they're allocating that. So that's going to be some advocacy things we can talk about for later. Next slide. So our local funding, when we talk about how other counties are doing related to us, you can see here up through 2021, Forsyth County was at 0% for dedicating any local funds to pre-K or early ed. We were behind the ball in terms of Buncombe County, which is Asheville, Mecklenburg County, which is Charlotte, and Durham County. They were all ahead of us and forward thinking about how to enrich their childhood opportunities. I'm glad to say this has changed, and we'll get to that in a second. We'll go on to the next slide. So what has a pre-K priority accomplished to date? This is a quick overview showing the last 7 years. I won't go through it in detail, but I would like to point out that the KP Reynolds Charitable Trust was an early collaborator and continued to support us. This concept of universal pre-K really resonated with the great expectations work that they had started, and they continue to help fund some of the work around this. Particularly my project in helping manage the coalition, and then also some of our public education campaigns. I also want to point out in 2017, they started in earnest the pre-K priority to have a more formalized way of working. So they had a steering committee, and then they had 6 work groups that had a wide breadth of diverse stakeholders involved, and they met monthly to study and address some of the most challenging issues. And then moving into 2018, we'll go to the next slide. And that shows this kickoff that we did. This public education campaign started in 2018 with the help of M Creative. They're a local advertising firm and communications group that has been just wonderful in helping us get out the word about what pre-K is, how important it is, and to help the general public understand its significance and why we needed to get behind it and get our political the political will also behind it. You'll see we had a pop-up tent down there, and we tried to go to as many outdoor events and indoor events as well during this 2018-2020 period prior to the pandemic. So next slide. And you can't talk about pre-K or early ed without showing cute kids. So this is your cute kid break. It also really speaks to some of the things that we did online in partnership with M Creative and some of our other folks that were coalition members to get the word out and engage young families. And we really had to pivot to this in a big way in 2020 when everything had to go online. And so we really tried to stay connected to the work we were doing to children and families and celebrate them. So next slide, please. This was one of the things that really kind of bolstered what we were able to do as we were in the pandemic and trying to figure out our next steps. We had started a pledge drive, Take the Pre-K Pledge. Some of you, your names are on that, most likely. And it was just basically saying, as a citizen, I believe this is important and I want to be a part of this and tell our political leaders that we need to get on board. So right as the pandemic started, we had over 1,500 signatures, and we also had a bunch of organizations signing on as well. Let's move to the next slide. As the pandemic was surging that summer and we all witnessed the horrible murder of George Floyd, there was a really refocusing on equity, on how that impacted us in the everyday work that we were doing. We knew that we had to have greater intentionality around what this pre-K coalition was doing. And we partnered with Action for Equity and Latino Community Services to make sure that we had an equity lens and we had the inclusivity of Black and Brown families being directly factored into the work to come and the policies that we were trying to help change. Next slide, please. And then on to, thank you, the Early Childhood Education Task Force. Very briefly, what we ended up doing, again, during the pandemic is we had been reaching out for a long time to the community leaders and our political leaders saying, we need you to come alongside us. Somehow, it happened in the pandemic, and we had the Board of Education, the City of Winston-Salem, and the county commissioners all sign a resolution in support of forming an early childhood education task force. It's a big mouthful. We just like to call it the task force. And what they would do is really bolster the work that had already been supported by the pre-K priority and take a deep dive and get some of these folks that had not been at the table to come alongside us and move us to the next level. So we had a selection committee that put together a diverse stakeholder group of 32 members. It was a time-limited task force to 1 year. And if we go to the next page, next slide, you can see here, there was a lot going on for that year. This communication and relationship diagram really helps to show the many layers of the things that we were doing and the people we were working with. There were lots of communication, dotted lines, and different things happening. And I like to point out the challenge in work like this because we were working with previously established systems that had been built over the years. While many of the groups had worked together individually in various ways prior to this, this was really the first time that they were collectively coming together to make an impact and a change in the current system, in that pre-K system. And I will be honest, this work has not been without conflict. It continues to require dedication to working through some of our power dynamics, changing leadership, and we continue to encounter that and push through it. Next slide. So last summer, the task force was compiling their final report. It included 19 recommendations toward realizing a high quality system for Forsyth County. And you can see our website, prekpriority.org. It has the report there with all the recommendations and the details, but I won't go into that now. Next step or slide. But in short, I will say that the great thing about ending the task force at the time that we did was it coincided and aligned with what we were just talking about with Katura's group with the American Rescue Plan Act funding. So the government was sending down ARPA funding to Forsyth County, the city of Winston-Salem, and we were able to take advantage of a grant opportunity and request money to put into action the 19 recommendations that we had in our task force report. We were fortunately awarded $3.7 million from the county and then $350,000 from the city. And this will go towards establishing the foundation for a high quality system. What we're going to do is we're going to infuse supports and resources for a cohort of 30 existing classrooms. That will include 540 children, all of their family members, 60 teachers, and that will be in various sites across the pre-K landscape. And there'll be 6 of the pre-K priority partners that are going to be supplying those direct services. And our fiduciary administrator for this whole project is Smart Start of Forsyth County. So next slide, please. In a nutshell, what I will tell you, everybody's been saying, well, where are these classrooms going to be? They're going to be spread across an equitable mix in our current pre-K system. We anticipate, we're going through the process right now, trying to make sure the selection process is done equitably, but there'll be 4 in the Winston-Salem Forsyth County schools. There'll be 4 classrooms in Head Start classroom centers, and there'll be 8 of the North Carolina pre-K classrooms in the community centers. And then for the biggest slots of the 30 will be 14 of our private or independent classrooms in the community that don't receive public funding. So all of these will get resources to support high quality. Move to the next slide. So what can you do and what are our next steps? So the work of this 2-year model cohort will continue and will be supported by the pre-K priority, but the pre-K priority has a big lift to continue and to work on. The ongoing advocacy, because the 2-year funding will not be sustainable unless we can show great outcomes and continue pushing for the support. At the local level, what we want to do is become a part of the city of Winston-Salem's annual budget. We want to become part of the Forsyth County annual budget, just like they have in those other counties I showed you before. At the state level, we have the Leandro case that some of you guys may have heard of. It's incrementally going to be increasing funding for our NC pre-K program that we talked about that we're currently underfunded in. So if that, it's in litigation, it's been in litigation for 30 years, but we're hoping there's going to be some movement on that in the next year. So that could seriously increase the number of children that could enroll in NC pre-K here. Also, we want to support Governor Cooper's budget proposal last year. It was to increase NC pre-K for at least 1,500 eligible 4-year-olds. And then at the national level, question marks. We know last year with the administration's push that they were working towards an American Families Plan. That would have been free and high quality preschool for all children that were 3 and 4-year-olds. We were holding our breaths, and unfortunately we had to exhale and not realize that because it didn't come to fruition. But we are grateful that currently this is being looked at in a new way. I will say to your right, you can see that on this bus, we had a bus ad and we continue to have these off and on, and it says raise your hand for pre-K and for 4-year-olds. And so what we'll continue to do is to ask the community to come alongside us, take the pre-K pledge, and probably in this next year, we're going to have something that's more accessible for folks to understand how they can come alongside us and support us as we go forward. So thank you.